Today's coffee talk is about bruising when we do skin booster injectables or fillers or any injectable treatment around the face, around the mouth, neck and décolletage, backs of hands and so on. It's a puncture mark into your skin, and if you saw, and I'll show you here, the vasculature of the face, neck and décolletage, but most particularly around the mouth area, it is the most sensitive part of our body, is awash with arteries, veins and capillaries. And capillaries are the tiniest little things that are doing their job. You and I, or anybody else, could think that this is only the amount of veins and arteries that are around the face. But to be honest, this is the real deal. The face is very vascular. It's one of the most highly, richly supplied areas when it comes to blood vessels, capillaries, veins, arteries. And that's why even a tiny needle, and we use the invisible needle here as much as possible, can sometimes cause bruising or swelling. So here's a very quick breakdown. Arteries and veins. The face has multiple branches of external and internal carotid arteries, like the facial artery, the superficial temporal artery, and the infraorbital artery that's around the eye, among others. These supply most areas where injectables are used, which would be the cheeks, lips, nasolabial folds, etc. Just like here. Then there's veins. Veins are often harder to spot and avoid because they don't have the same muscular walls as arteries do, and they can vary from person to person. Hitting a vein with a needle, even the tiniest needle, is a common cause of bruising. Even if you had your vaccine in your arm, you'd bruise. We have capillaries, like here, tiny blood vessels. They're everywhere under the skin, especially in areas like around or under the eyes, around the lips, and this adds to the risk of minor bruising, a bit like what I got 4 days ago when I had mine. This is why, even with excellent technique, bruising can still happen. It's completely normal. It happens to the most experienced of injectors. So what can you do about bruising? Well, what I tell you is to expect it. It's very common. It's a normal side effect after any injectable. And the skin on the face is so delicate. There are many, many small blood vessels just under the surface, particularly around the lips. So even with the most precise technique, it's possible to get some bruising. Now, it's usually very minor and fades within a couple of days up to a week, and it doesn't affect the results of your treatment. You can continue to use a concealer. Here's one. This one's got a lovely little sponge on top, and it actually conceals nicely. Or you can use a concealing pencil, which I use oftentimes because it's very precise, and I just use it here. I use this actually as a lip liner normally. There you go. If you're ever unsure or if anything feels out of the ordinary, I'm always here for you to check in with you, and you have a direct link with me even out of hours. So in conclusion, what bruising you experience is very normal. This won't be an issue in a couple of days, and there is nothing permanent going on. It's a regular bruise that takes time to resolve. I hope that helps. It's part and parcel of your prep when you come to see us. We usually send an email to tell you to expect it. Some very good things to have to hand would be ice packs. We use them here anyway, but ice packs at home. But if the bruising has already started during the injection time, it's going to be there. But we use numb packs here. Eating pineapple, the fruit, not just the juice, helps because it's got bromelain in it, and that actually helps in relation to healing bruising faster, and so does Arnica gel. All right, I hope that helps.